I'm John Elefteriades. I'm from Yale University. I'm the William W. L. Glenn Professor of Surgery, and I direct the Aortic Institute at Yale University. I've just presented here at the International Academy of Cardiology Annual Scientific Sessions 2018 in Boston. And my talk had to do with the practical genetics of thoracic aortic aneurysm. My great mentor, a wonderful surgeon scientist, Dr. David Tilson, was the first investigator ever to identify patterns of inheritance for abdominal aortic aneurysm. And I remember when I was a very young doctor sitting in the audience when he presented his findings in the late 1980s. And I remember just how thrilled I was to hear such a new concept that my mentor had developed. No one had any idea that abdominal aortic aneurysm was an inherited disease. We stumbled upon the family patterns of thoracic aortic aneurysm when I was interviewing a patient. I was interviewing a 59-year-old lady. We had operated on her for an aortic dissection a few days earlier. And she was well enough to have a conversation, and I said, "Ma'am, has anyone else in your family had such a problem?" And she said, "Doctor, don't you remember you operated on my mother 15 years ago for the same exact thing?" And I had no recollection of that, of course. And then I said, "Ma'am, is there anyone else in your family who's had a similar problem?" And that's when she started to cry. And she was inconsolable. Finally, she was able to say the words, they said it was her heart, my little girl. And it turned out her 12-year-old daughter was the youngest individual ever to die at Yale University of the same problem, a type A dissection. So there we had 3 generations in one family. And then our team went to work, and we did family tree after family tree. And we found that 21% of the time, when there had been one aortic dissection in the family, there was someone with an aneurysm, a known aneurysm, among the family members. So the real rate will be higher than 21% because many patients harbor aneurysms and don't know about them. So then we went to work. Dr. Milowitz in Texas did the most world-leading work. We went to work and we studied this. And the focus of my talk today was on the application of new high-technology molecular genetics to practical care of patients in the present era. So, you know, something like arterial sclerosis is very complex from a genetic standpoint. There are many, many dozens, probably hundreds of genes that contribute a little bit to the development of arterial sclerosis. Thoracic aortic aneurysm is in a way simple because it's one letter change among the 2.2 billion genetic letters in the genome that can cause a thoracic aortic aneurysm. Not only one gene, but one letter change. And there are 31 such mutations that medical science has identified. So we got a head start with that at the Aortic Institute, and we have been sequencing by what's called a next generation sequencing or whole exome sequencing. We sequence everybody who comes in the door. And we have hundreds and hundreds and hundreds of those gene sequences that have been done. And we've been able to use those to stratify and personalize the care for an aneurysm. Before, if you had a thoracic aortic aneurysm, you all went into one bucket, all the patients went into one bucket, and you operated at a certain dimension, 5 or 5.5 centimeters. Now we know that among those 31 individual mutations, some 5 or 6 of them can suffer a tear, a dissection of the aorta at a very early size, often without even having an aneurysm. So now we take them and we put them in individual buckets. And the thrust of my talk was essentially, we are there now. We're at a very high technology, very advanced modern state in aortic care, where we can determine for many of these patients the one letter change that caused their aneurysm to happen. And then we look up in a dictionary and we see what the operating characteristics are for that mutation. And then we know exactly when we should operate to keep the patient safe. So we are literally, we have just crossed the threshold into the modern era of personalized genetic care based on high technology whole exome sequencing.